Virgin Islanders living in the territory and living abroad. The Virgin Islands Economic Development Authority needs your help. We are preparing a 20-year economic vision for St. Croix, St. Thomas, St. John, and the territory as a whole. But we need your input to create the plan, which we have coined Vision 2040. Go to USVI2040.com and take the survey Vision 2040. Prosperity for all.
Wash your hands. Hey, you violent, my boy. Well, every time that you get a chance, you have to wash up your hands. Put on your mask, practice some distance, stop spread corona. Like, it's animal. And on behalf of the Virgin Islands Department of Health, hold it down on all the mass gatherings. Wearing a mask not only protects you, but it protects your loved ones and your community. Like, help stop the spread corona.
Good day, Virgin Islanders, at home and abroad, and a very, very happy holidays to you. Today is Pearl Harbor Remembrance Day. This marks the 79th anniversary of the day that our nation was plunged into the conflict of World War II in response to a sneak attack on the Navy fleet based in Pearl Harbor, Hawaii. It was a pivotal time in our nation's history. Men and women answered the call for service across the nation, some of whom were from our very own Virgin Islands. Many of our parents, grandparents, and great-grandparents were part of that war effort. It was a pivotal point in the Virgin Islands history because it marked the moment that our community collectively acknowledged that the battles deemed important to the United States were equally important to us as American citizens. And so today, as we remember that fateful day of 79 years ago, we also remember all those servicemen and women that serve, their bravery and their defense of this nation, and the democratic values we all enjoy sometimes and take for granted. I just want to pause for a second on that because, I was just talking about it's been almost 3 generations now that we haven't had a world war. And we sometimes forget how impactful that was. A lot of our younger people have not seen that, and it's good for us to kind of revisit that day with them. Those of us who remember September 11, 2001, 9/11 incident and the shock of that, the space shuttle blowing up, all events throughout our history that marked different spaces, but Pearl Harbor and 9/11 really brought Americans together in a fight, much like the world is coming together today to fight coronavirus. But today begins the second week since the Thanksgiving holiday. And I really want to take this time again to urge our residents, guests, and especially those of you who have travel plans. You got family or guests coming into the territory from all over, that for the upcoming holidays, please, if you're planning to host a get-together party or whatever it is you're planning to do, just rethink those plans right now, because If you're paying attention, you'll know that we know that we're seeing a consistent increase in the active cases across the territory since the Thanksgiving Day holiday. And we expect that as these days goes by, it's going to get worse. And those cases will continue to rise. Many of you are probably aware now that the cases involving a family on one of our islands that hosted a Thanksgiving gathering for upwards of 35 people. They totally went against what the CDC recommended, what we said, and as a result of that, the Department of Health is having dozens of coronavirus cases. An initial case where you only had 12 people infected, but those people go out and they create more infections. So, you know, we have these sessions. I mean, as governor and as an administration, we have taken painstaking time to come out and tell you about what's going to happen. And just as we predicted for Thanksgiving, we're seeing this in our territory. I know it's been a long time since we've been dealing with the coronavirus, and we're all exhausted. Trust me, I'm exhausted too, in hearing about the virus and all that it does. But we can't afford to be complacent about it just because 9 months have gone by. And I must say, in the Virgin Islands, I tell people, governors that call me, and congressmen, people, news reporters from the States, my people of the Virgin Islands have done a tremendous job in fighting this coronavirus. The problem is that all it takes is one person to make a complete disaster of this beautiful territory that we have. So we all have to remain diligent, because many of the people that are getting the virus in the territory are asymptomatic, or they have very few signs. If you're paying attention to the numbers that we have actually very few people that actually are hospitalized because of coronavirus. So you can't see or sense who is infected with the virus. It would have been good if everybody who got the virus turned blue. Then we would know them when they come in. But that's not the case. The best of friends, closest of family are infecting one another because they're not following the guidelines that we put out to protect you and your loved ones. Now, don't get me wrong. You could do everything you can and still get coronavirus. You could wear your mask, wash your hands, and you may be unfortunate to end up with getting the virus. But you have to do everything you can, because in order for you to get it, 3 things have to happen. You have to come into contact with somebody wearing the coronavirus. That's number one. Having the coronavirus, that's number one. Number 2, you have to have an immune system. You have to be able to contract the virus from that person. Not having on your mask, touching the person or things that they've touched and putting them in your hands and your nose. That's the second thing. So you got, number 1, you got to find the person, then not protect yourself against the person and get the disease. And the third thing that has to happen is that your immune system has to be weak enough that the virus takes over in your body. So you have the power of at least that control, and we're asking you to exercise it. We're seeing exactly as we predicted it coming into our government offices, and we're having to shut down executive and non-executive branch agencies and private sector. It's creeping in. That's why we ask you to please thin out your office this week and next week, because it's so easy now for us to identify the trend of this virus and how it infects our society. Like I said, we already have a few government agencies that have been closed as a result, and employees are quarantined because of this exposure. Now, as we head into this holiday season, I strongly urge you to not plan gatherings and do not attend any gatherings. And please, discourage your loved ones from attending these gatherings. On our side, we know what's coming, so we've done the work. We've ramped up on our testing hotels, hospitals, testing restaurants, making sure we're testing at the airport, and doing everything we can to quarantine and identify those people as soon as we can. I also want to make everyone secure and maybe somewhat alarmed that we're going to put in further restrictions for this in order for us to beat and manage this pandemic. Within the next few weeks, We had some delays, but we wanted to do that as quickly as possible. We will be instituting 100% testing at the airport. So if you go away and you don't have a test, you're not going to be able to get back in the territory at all unless you get a test at the airport. And then for individuals who come to the territory without a test, you're going to have to pay for a test at the airport. If you don't want to pay for the test, well, you'll be getting a fine that is sizably more than what we have to pay at the airport. This is for local and tourists alike because we have to keep people safe. And not only are you going to get that fine, but you're still going to be subject to the testing. You're still going to be subject to the quarantining for the 14 days. So we're about to get this done. The only thing that's limiting us is some software changes that we have to do, and of course, we also have to have the capacity to have the tests for people ready, because there's a lot of people coming into our airport, especially in the St. Thomas, St. John district. We have been really successful thanks to the efforts of our tourism department in getting onto the American Airlines initiative now, so you can actually get pre-tested before you even board a plane, which is beautiful. That service is available to people flying on American Airlines. And we will continue to try to look for this type of partnerships with all our airline carriers to make sure that we're bringing people into the territory on a safe note. As of this morning, we have 1,356 people for COVID-19 since our last update. That is, we tested 1,356 people since the last time we were here. And out of that, 105 of those people tested positive, which means our COVID-19 positivity rate for the last week is a little above 7%. This number is not bad considering what's going on in the States, but it's bad. I mean, we shouldn't have a positivity rate of more than 5%, and we're going into the holiday season and our on-season for tourists. So it is not where we want to be at all at this point. And we are really troubled by the high incidence of coronavirus, especially on the little island of St. John, where we have like 31 active cases this morning. We've had more people with coronavirus almost tested positive within the last week than we have within the last 9 months on St. John. And it's more concerning because it's the island where we have the least resources. We have the least testing, the least medical facilities, the least resources to attack and help the virus. So we're ramping up our resources there to make sure we keep our St. Johnians safe. So we are not out of the woods by any stretch of the imagination on this coronavirus pandemic, and we have to remain vigilant on all three islands. Don't feel safe because you're in St. Thomas or you're in St. Croix. Do not feel safe. It is out there. As of this morning, we have 109 cases in the territory. This is the first time that since our shutdown, that we've actually passed the 100 mark on our active cases. We've tested 29,754 individuals thus far, and of those tests, 28,014 of the tests came back negative, and 1,649 came back positive. So our total count in the territory for coronavirus incidents is 1,649. We don't so much look at that anymore. We look at how many active is, which is over 100, which should be of grave concern for all. And the 1,517 of the individuals who have tested positive since March have successfully recovered. And as far as hospitalizations, thank God we only have one COVID positive patient at Juan Louis. Unfortunately, that person is on a ventilator but stable, and one COVID patient in the Schneider Regional Medical Center. I just want to take a little moment to ask you for your prayers too for our sister island of Puerto Rico, where they have over 100,000 cases of coronavirus, and just yesterday alone they had 2,500 cases reported, and they're up to 1,200 already for the day. So not good over there on that island, and we ask that you pray for them as they go through this pandemic. Now, it is my personal belief that we can test our way out of a surge, but we need your help. And I say this because we tested our way out of the Lime Tree surge by just making sure that we were quarantining people fast enough. But you got to help with that. You got to help us quarantine people as quickly as possible so the virus doesn't have a chance to spread. So if you know that you have been exposed to somebody that has the virus, don't wait for the test. Don't even wait for the test. Just quarantine yourself. Call the Department of Health and get your test registered. But please, don't go around people and don't go to work. Assume that you have the virus until you get a negative test and remain isolated and quarantined. See, none of us want another lockdown, but if we have to, we will. But I know you don't want a lockdown either. We are so close to getting the vaccine distributed. So let's all work together to just stop the spread. And I have some individuals, Dr. Hunt is here, as well as Director Joshin, to tell you a little bit about the vaccine and what's coming down there. And I know some of you are cautious about this, but this governor will be the first person with his arm out, to get the vaccine to make sure that we're keeping people safe. Since our last update with labor, we've received 182 applications last week. That brings it to a total of 17,441 applications since March. That's a lot. And so far they've processed 16,503 of those applications, which is 95% of applications processed. And I know the Department of Labor was getting some blows last week in the press. And I continue to tell people the fact that Commissioner Gary Malloy and his team were able to issue 10 years of unemployment claims in 8 months. 10 years. They only distribute about 8 million a year in regular times. So we're talking about 10 years of unemployment checks in 8 months and still maintain a 95%. I know that doesn't do any good to the people who haven't gotten a check yet, but trust me, we're implementing some new things and we're working on being able to make sure that you too get your check. I know it's the holidays. I know you have bills to pay. We are working on that. So far, they've issued regular unemployment insurance check of $37.8 million to VI residents, as well as they have also issued 28,328 unemployment payments to people who have from the pandemic unemployment claims. That's 44 million there. And also the department has also issued 5,111 pandemic unemployment assistance checks, totaling $8 million there, and $3 million in pandemic emergency unemployment. So as I said before, there are a number of programs that they're administering. So don't get frustrated when you get rejected from one. Please just fill out the paperwork and get it there. We didn't make the system. We inherited it from the federal government, and that's the way it runs. So we want to make sure that you get it. To date, we have issued 83,000 checks. I want you to think about that for a minute. 83,000 checks, 83,000 checks. That's almost a population of the entire Virgin Islands. And that's just unemployment insurance, totaling $93 million. Like I said, that's 10 years of unemployment claims, maybe almost 11. So if you're having a problem, please visit their website at vidal.gov, or you can visit their offices in St. Farm, St. Croix, and of course in Contant, across by Griffith Park, there in St. Thomas. After this soft shutdown. So we're just trying to keep people out of the office for these 2 weeks to try to control the spread, to try not to have another total shutdown. The other thing that we're doing is we're pleased to announce that we've issued out income tax refunds. This latest issue of refunds is about $15 million, and it includes tax refunds for 2018. 2017 is about finished. 2018 we're doing now. It also includes $5 million we issued last week, as well as to 100,000 tax filers. So 100,000 tax filers in the territory got checks last week. That means some people get 2 and 3 checks. Despite the challenges posed by the pandemic, the Bryan Roach administration is continuing to make good on its commitment to the people of the Virgin Islands. Because since taking office in 2019, we have actually issued 37,000 income tax refunds totaling some $112 million, 68 million of that in $68 million of that in fiscal year 2020 alone, and that's during the pandemic. So we did the responsible thing in the budget and made a commitment to you that we're going to get your checks to you, and we were successful in doing that. We met our goal, and we still came in under budget in 2020, and we will continue to do so. Just a little reminder, if you have not gotten your stimulus check, and you have filed your tax return for 2018, please call the Bureau and find out why. Unless you are claimed by somebody else, you should have gotten that check come through, and you should be whole now. We got about $13 million left. We want to give you the check as quick as possible. So call, find out why your check has not been issued. We should have the hotline up soon so we could get people going a little quicker on that. But please call them, find out why you haven't gotten your check, because we want to get that check for you in time for Christmas, and please spend local. In closing this afternoon, I want to say a few words about tomorrow's special session of the 33rd Legislature. Now, I've spent the better part of the last 3.5 months having conversations with Virgin Islanders on talk radio, and as I move about the community, I get a lot of questions and entertain the conversations. I've had the opportunity to answer questions and address concerns about the debt refinancing proposal, otherwise known as the debt securitization. And in those conversations, what I've really found is that Virgin Islanders are not really against the refinancing of our debt. As a matter of fact, they agreed that a 25% reduction on the interest we currently pay on our debt is a good idea and worth pursuing. That would be like you going out to buy a pair of jeans for $100 and the guy telling you could get his coupon to get them for $75 and you refusing and say, no, I want to pay $100. No one has come out to really say that refinancing the debt is a bad thing. As a matter of fact, we had several legislators who were telling us, why are you only borrowing for the $1 billion that we owe? Why don't you refinance the whole thing? And we tell them, well, we can't. This is as much as we could float in this one entry. So the only logical objection that is left is saying that taking that savings and using it to address government projects and obligation, one of which is a GRS, is a bad thing. Because if you're saying, getting a discount is a good thing, then the only reason you could be opposed to borrowing is because you don't want us to give it to the GRS. So you need to ask, the public needs to ask people opposing these measures, what is it that they don't really agree with? The debt is already issued. We are not taking out a penny more. We already owe this money. We're just getting it at a cheaper rate. So if you don't want to give money to the GRS, then say that and vote to refinance the debt, save money, and lower our debt payment annually. But the one thing we cannot afford to do is lose this opportunity by simply doing nothing. That's not an option. On the eve of this session, I want to make sure that there are a few things that are clearly understood regarding the securitization by you, my listening public, and my constituents, my residents of these Virgin Islands. First of all, this is not the full fix to the GRS insolvency. We never profess that to anyone. This is one part of several different measures that we are pursuing all at the same time. Measures that we campaigned on and told people this is what we're going to do. But this, however, presents an immediate opportunity that makes sense to pursue, even if GRS was not in a crisis. I want to say that again. So even if GRS wasn't in crisis, it would make sense for us to pursue this and get the refinancing we need at a lower rate. While I'm doing this, I really want to dispel some of the myths. We are not increasing our indebtedness of the government. The debt is already owed to the bondholders. On the contrary, we are refinancing that debt to realize savings on the interest and to reduce how much we ultimately pay to those bondholders. We are not giving up the lockbox. I keep hearing that lockbox talk a lot. The lockbox that these bonds are said to be placed in, if anything, we are creating a secondary lockbox in the form of a special purpose corporation, which is called the SPV or the securitization. We are just allowing for the special corporation, which is only obligated to pay what is owed to the bondholders and remit the balance, the rest of the money, to the Virgin Islanders, like it has always been done in the past. All of that money will be left to the Virgin Islands. This deal is so good. And I'm saying it makes so much sense that even our co-bond holders, right? Bond issuers, Cruz and Rum and Diageo are giving up the lion's share of their savings to the Virgin Islands to help the people of the Virgin Islands. One giving up 70%, the other giving up 60% of their savings to the Virgin Islands. The corporation is authorized to do nothing else but issue these notes as the legislature, and they are accountable, as the legislature authorized them to do, and they are accountable to both the legislative branch and the executive branch. You know, Virgin Islands people are very smart people. Think about it. The SPV was authorized in September. If what they're saying is true, then the SPV would not have to come back to the legislature to borrow money. If they were not controlled by the legislature or the executive branch, I could simply say to the board members, let's go borrow this money anyway. But it is not the truth. The truth is that they are controlled by the legislature, and that's why we must go back again to get the revisions in order to get this bond note authorized. The myth that the government doesn't control the SPV is simply not true. Finally, yes, the legislature can choose to appropriate these savings however they choose. If I agree with them, I will sign on. And if I don't agree with how they say they're going to sign it, they can simply override me. They have the power to decide where the money goes. But I have made it abundantly clear from the beginning that once the savings have been captured, the first and the best use of these savings is to provide the immediate infusion of cash to the GERS system. This buys us the time to avoid a cut in the retirement pensions while we continue to work on other ways that we can secure the system. Those initiatives include collection of the excise taxes. We've always planned to do that. We've said it from last year. At least half the money for excise should be guaranteed to floating a bond for the securitization, pursuing the gasoline excise tax. We are working with the delegate. She already has a movement in Congress and a piece of legislation to do this, spurred on by the good Senator Stedman Hodge. The development of internet gaming, we continue to pursue this initiative, and we have some different amendments coming to make that viable in the territory. The taxation of adult cannabis, we've been trying to get this done for over a year now, and hopefully we can see some light at the end of the tunnel. The expansion of the rum distillery industry, and last but not least, the restructuring of the benefits for the active and new government employees, because that has to happen too. You can't just throw money and expect it to be fixed. I sit up late at night and I think about our relationship with the legislature and the other entities in the government and how they work historically. And how do we change course on some of the things we do? The system of checks and balances in any government, not just ours, it exists to do that. Check and balance. They are not adversarial. It doesn't mean that we have to be at war with one another. There's not a person in the legislature that doesn't want the GRS fixed. And I certainly want it fixed because I'm putting forward this. So if that is the truth, right, the executive and the legislative branch should be working together to bring the solution. Our proposals, along with their proposals, will ultimately lead to the final solutions. They don't have to be in conflict. If you don't like what we propose, add value. Give something to make the proposal better. Tell us how to do it. If you don't want to give the money to the GRS, simply let us refinance, because refinancing will bring savings to the people of the Virgin Islands and extra money anyway. But one thing we're going to not do is do nothing. We have to ask. Remember, on each one of these proposals that we're doing, it's not instead of. We're not going to do the cannabis instead of the excise tax, or the excise tax instead of the distillation, or the distillation instead of the gaming. It's in addition to. In addition to the measures that we have proposed here, there are a lot of other measures that we need in order to bring our GRS into solvency. But today, this governor will not kick the can down the road. I will work actively, win or lose, to make sure that we are addressing the problem. But it's up to you, the people, to help me, to get on board and realize that the plan, the real plan that we have before you, is the only plan that exists. If you have a better one, bring it forward, and I will support it as well. This is not an ego thing. This is a real thing. So late at night when I'm in my bed and I get frustrated with having to explain to people the importance of this securitization, I think about that old lady or senior man in their house, thinking about their check, worrying about if they're going to pay their WAPA bill and their medicine. I think about people who are barely existing now. I think about future retirees, my friends, family, people I know and from the community just walking around, who are not going to be secure if they retire. You see, retirement isn't meant to be a reward for work. It's a payment when you can't work. And there are a lot of individuals that are getting that money now that can't work. They can't go back out to work. They can't find another job. They can't start another career. We owe it to them to work tirelessly until we find a solution. And you have my promise today and always that I will continue to fight this fight, regardless of the outcomes that we see. I thank you for listening to me. Now I have Dr. Hunt here, who's going to share some words with you about the vaccine and other information from health. I hope that you're encouraged. Dr. Hunt.
Good afternoon, Governor Bryan, Virgin Islanders, and to all the viewers. Thank you for the incredible honor of addressing you today on behalf of Commissioner Justa Encarnacion on the amazing work being done at the Department of Health under a Joint Unified Command COVID-19 pandemic response. The Joint Unified Command response is evident, as I have the pleasure of speaking today along with the Director of ITEMA, Daryl Joshin, someone whom we have worked with relentlessly daily to protect my fellow Virgin Islanders against the ill effects of COVID-19. I'm typically nervous when I must speak publicly, but I am never shy with sharing the facts on the fields in which I have been trained. It was necessary for me to share my firsthand experiences at this press briefing months ago to provide insight on the fatal and devastating effects of this virus and hope to inspire behavioral changes. It is my pleasure to return today to provide education on the COVID-19 vaccine and the plans for the territory. Director Monife Stout introduced this discussion when she provided the background of Operation Warp Speed and how the Immunization Division has been working overtime with local and federal partners to prepare the territory for the safe vaccination of Virgin Islanders. I would like to recognize her for her leadership, along with Director Francine Lang, on their success of managing this essential component of this pandemic. We refer to medical treatments of this disease as medical countermeasures, and the development of a COVID-19 vaccine is the most significant medical countermeasure that has been established thus far. I caution those that publicly denounce the safety or efficacy of vaccinations. This approach discourages immunization of the people of the Virgin Islands and decreases the chance of us developing herd immunity. Without the proper knowledge surrounding the vaccine development process, this behavior is irresponsible and will further contribute to the rise in death and long-term complications of COVID-19 and the disproportionate rates among the people of ethnic minorities. Yes, we are within the highest category of those most affected by the virus. The evidence is clear on the morbidity and mortality of the SARS-CoV-2 virus, both locally and globally. The goal of the vaccine is to end that reality today. I am here, and please allow me to speak to you as your local expert. I'm board certified in infectious diseases, which encompasses the study of viral diseases, and have a master's degree in public health and epidemiology. While I was in medical school at Howard University in the nation's capital, I researched vaccines at the bench level by doing lab experiments to study neutralizing antibodies with assays using cells in test tubes in a biohazard safety level 3 lab at the Vaccine Research Center at the National Institutes of Allergy and Immunology within the National Institutes of Health, the division that is headed by Dr. Anthony Fauci. While I interned at the Vaccine Research Center, I contributed as an author of my first medical publication on neutralizing antibodies in vaccines under the supervision of Dr. John Mascola, one of the leading investigators in Operation Warp Speed. I can confidently speak to you about the truth about vaccines from my own training and research. As I stated numerous times before, vaccinations is one of the top 10 public health achievements in the 20th century. Vaccinations has extended the human lifespan and significantly improved quality of life. And access to vaccinations is an important facet of public health that is prioritized at the Department of Health. Through our involvement in Operation Warp Speed and daily communications with our Region 2 partners, the Department of Health has ensured that the territory has not been left out of the federal distribution to mass vaccinate. The process by which vaccines are developed are done with evidence-based research practices to ensure efficacy and prevent harm through the various phases of clinical trials. The COVID-19 vaccine has been developed in the same manner. The process was done as fast as possible because people are dying and will continue to die without introducing immunity to the public to dramatically reduce the rate of viral transmission throughout humankind. Clinical trials were quickly organized in 5 nationwide jurisdictions, and I discuss frequently with my training colleagues in Miami who participated as investigators in the clinical trials to confirm the integrity of the process. Over 100,000 people volunteered to participate in several vaccine trials to determine if there would be a safe and effective vaccine. The clinical trials, or the experimentations, are over, and the data is clear that the vaccines that are being mass-produced for immunizations are ready. I need to emphasize my last statement to assure the public that any belief that initial vaccines will be given experimentally is completely unfounded and false. There will be no guinea pig trials in the Virgin Islands. The experiments are done, and we were not participants in the clinical trials. The Food and Drug Administration and the Advisory Committee on Immunization Practices are in the final phases to approve and authorize the use of the vaccines. COVID-19 vaccines are developed using the same techniques as all other vaccines and are safe. The materials that are used to make vaccines are safe to be injected into our bodies because all vaccine ingredients already naturally exist in our bodies in much larger quantities. This is a common concern I hear from my patients. Moreover, the risks of receiving vaccinations are exponentially lower than the risks of many other things that contribute to chronic diseases and cancer, such as the consumption of drugs, alcohol, tobacco, and unhealthy food, and other self-imposed risky behavioral practices that we commonly do day to day as a society. The decision to become vaccinated against this potentially deadly virus should be made after listening to the facts. It is highly encouraged, but will be voluntary. Our process ensures the safety of the product as well as the safe storage within the territory upon the delivery from the vaccine suppliers. Have a discussion with your healthcare provider to determine if there are any medical contraindications for vaccinations. Educate yourself from the facts and not what is harmfully perpetuated on social media. We work for you to ensure the USVI is not excluded from receiving immunity from COVID-19 while the rest of the world is vaccinated. I am asking you not to contribute to the disparities that we suffer from in this territory. The department will prioritize the distribution under the federal allocation restrictions, but will ensure access to all once production is widely available. This is the primary pathway to our return to normalcy and safe socializing, which includes carnival festivities. Simply stated, COVID-19 can potentially kill you, but the vaccine can prevent you from getting the virus. There have been over 277,825 deaths, which increases by the thousands daily. Please remember that. I want to thank the governor and his team for their tremendous support during the entire COVID mission, and I hope this gives you some insight on the significance of receiving the vaccine. I will gladly take any questions.
Thank you, Dr. Hunt. I am, after hearing her rendition, it's like I'm reminded of my millennial partner, where he always says to me, facts. We listen to all kinds of things, and here we have professionals who are actually studied this with Dr. Fauci and other professionals telling you the security and all of the thought that went into these vaccines. So, like I said, I will be one of those individuals who will be of the first to get the vaccine to make sure, number one, as I said, the example, and number two, to keep me and my family safe, as well as you safe. Director Joshin?
Thank you, Governor Bryan. Good afternoon. I'm Darrell D. Joshin, and I'd like to take this opportunity to update you on some events within VITEMA. The record-setting 2020 Atlantic hurricane season is behind us, with a tremendous 30 named storms, of which the territory was spared any direct impact. I want to thank everyone for their preparation, their efforts to include rethinking our capabilities and limitations with COVID-19. We've already begun to look into next year's hurricane season and have partnered with the Department of Human Services, the University of the Virgin Islands, and the University of South Florida in conducting surveys in English, Spanish, and Patois focused on the concerns of individuals when seeking evacuation shelters under a COVID-19 threat. Please visit the VITEMA website and Facebook page to participate in the survey. As a territory, we have been in both a national state of emergency and a territorial state of emergency since 13 March 2020 for COVID-19 pandemic. I want to thank both Governor Albert Bryan Jr. and Lieutenant Governor Terdenda Roach for their continued leadership as we navigate the many uncharted waters brought about by this pandemic. Constant vigilance is required. We must not let our guard down. We must continue to work together to realize that both visitors to the territory, as well as those living and working every day, must comply with the requirements of Governor Bryan's executive orders. In the past several months, we have worked closely with the Department of Health, our hospitals, our health providers, the Virgin Islands National Guard, FEMA, the Center for Disease Control, the U.S. Health and Human Services, and Operation Warp Speed to plan, exercise, and now stand at the ready to receive and administer the COVID-19 vaccine. The goal is that once the FDA provides the approval for the emergency use authorization here in the U.S. Virgin Islands, the vaccine is available and distributed based on the allocation at the very same time every other state, territory, and Commonwealth receives their vaccine allocation. For further communication activities involving COVID-19 vaccine distribution and implementation timelines will be coordinated through our Joint Information Center, known as a JIC, as well as our normal media outlets. The vaccine logistics deployment from manufacturer to local health provider will remain a key measure to the success of the U.S. Virgin Islands in keeping pace with its allocation and availability. As with any major emergency response, it takes the combined efforts of many public and private agencies at both the local and federal level. Our joint unified command, the Department of Health, the National Guard, VITEMA, and FEMA ensures the unity of effort in planning, assessing, and implementing not only the mitigation efforts, but our vaccine efforts throughout the territory. This is a very exciting time for us as the first phase of COVID-19 vaccine becomes available to our health providers and long-term health care facilities. Thank you for the opportunity to provide an update for VITEMA today. Besides our website and our Facebook, you can contact Vitima by phone on St. Thomas at 340-774-2244, on St. Croix at 773-2244, and on St. John at 340-776-2244. Thank you very much. Back to you, Governor Bryan.
Thank you, Director Josh. And just by way of I'm looking at the comments. People are wondering about events. There is no mandate to cancel events as yet, but we are, as Government House, we had a number of events scheduled for Christmas, including drive-thrus. We're going to go ahead and cancel our events. We just don't want anybody to have any reason to gather for any reason. Ours was a drive-through where we were distributing goodies and stuff while people drove through, but we're going to cancel all of that because we expect to see the numbers increase throughout the week, and hopefully by Christmas maybe we get start to get a drop in these numbers. But for the foreseeable future, I think that things are going to be progressing in an upward way in terms of the coronavirus. The other thing I want to announce is Vision 2040. It's my vision. It's your vision. You need to participate with that. You can go on to the Vision 2040 website at the EDA, give your opinions about what the next 20 years are going to look like and what you would like it to look like, because we want to hear what you have to say. So please do that. And we are getting ready to go into tourist season. So we have a business forum. It's going to be community business forum, and that's scheduled for December 16th. Please tune into that from 9 to 1. We have interaction from the cruise ships as well. I'm telling people how to do business under this new coronavirus and the things that we're going to do to make sure we have some economic activity. So that's all I have. We will be taking some questions from the press out there. We don't have any questions. Modern miracle. They don't miss me anymore. But I just want to urge you to stay blessed, stay safe. Remember, call your senators. Let them know you support the cannabis bill. Let them know you support the securitization, that our GRS needs a chance, and we need a fighting chance. So wear your mask, wash your hands, be safe, be blessed. Love you. Have a great day.